To chew or not to chew, the effects of smokeless tobacco, created and presented by Julie Nash. After the presentation, you will be able to define what smokeless tobacco is and the many forms it comes in, be able to understand the risk of smokeless tobacco and systemic and oral health risks, identify the signs that can lead to oral cancer from smokeless tobacco, and be able to provide information to others on smokeless tobacco cessation. Who is at risk? Teenagers, specifically younger baseball players, softball players, and golf players. It started when establishments became smoke-free. Here is a famous clip from the 1993 The Sandlot, where Bartram finds his dad's chaw, or chewing tobacco, and wanted to kick things up a notch. If you have seen this movie and this scene, it was apparent that the chewing tobacco did not set well with any of them. What is smokeless tobacco? Smokeless tobacco is tobacco that is chewed, spit, or swallowed versus smoked. It comes from the Nicotiana tabacum plant, where the leaves are dried and made into many different forms. Most popular forms are known as dip, chew, snus, or snuff, which are usually loose leaf or in pouches. Snuff can be dry, which is meant to be sniffed, or moist, which is processed and placed in smaller pouches. The newer form comes in a pouch and is more natural than the loose leaf form, which is called Zin. Other forms are dissolvable tablets, sticks, strips, and even gums. These forms are usually used for tobacco sensation, but can have the same effects as smokeless tobacco. How does smokeless tobacco work? Smokeless tobacco can be placed anywhere in the mouth, but the most common location is in the lower jaw, between the lip and cheek, where there is a pocket or vestibule. The loose leaf tobacco has tiny crystal particles that cut and lacerate the tissues, causing a much easier and quicker nicotine tobacco dosage. These crystals are what cause the trauma or irritant. We as dental professionals encourage users to move it around if they are not interested in quitting, and avoid keeping it in the same location every time. This will help the tissue get a break from the irritant and will have a little healing time. With smokeless tobacco, users usually have a spit cup, which is a cup or container that is usually left somewhere where it can be spilled or where a child can find it. Pouches, dissolvable pills, or gums or tablets do not cut or lacerate the tissue, so it is much slower release of nicotine and tobacco. The byproduct of the pouches is typically safer to swallow than the loose leaf tobacco, but can still cause unpleasant taste, digestion issues, along with other systemic health risks. Health and systemic factors with smokeless tobacco include esophagus cancer, stomach cancer, and can lead to addiction. With the addiction, can lead to cardiovascular disease, which is heart failure and heart disease, pancreatic cancer, reproductive and pregnancy complications. Other risks are weakened immune system, delayed healing process, and is commonly a gateway to other addictions. Dental risks include, but are not limited to, temporary or permanent oral tissue damage that can lead to oral cancers, periodontal disease, which is loss of the bone that hold the teeth in place, and recession, which is loss of gum tissue, which gives the tooth a longer appearance. There's a higher risk of cavities due to xerostomia or dry mouth, and also discoloration and stained teeth. The most extreme cases is loss of tissue, teeth, and bone due to oral cancer complications. This is a picture of Rick Bender, a former smokeless tobacco user and cancer survivor. He was formerly a minor league baseball player who grew up with smokeless tobacco, or chew, because all the major league players did it. At the age of 24, he was diagnosed with oral cancer on the tongue and was known as the man without a face. The initial stages of tissue damage is where the tissue becomes irritated and has a whitish grayish appearance to it. It is where the tissue starts to overproduce cells to protect itself from the irritant or the trauma, much like a callus on your finger from writing too much. Most often, this stage is put off and put aside because it's asymptomatic, meaning the patient has no symptoms to it. But this stage can quickly change to oral cancer and other complications that we discussed earlier. If you start to notice these whitish areas on the cheek, lip, tongue, or floor of the mouth, please contact your primary dentist for evaluation before it's too late, like Rick Brender. Quit. You must find your reason why. You have to be ready. You cannot do it for someone else. It has to be for you. It will be hard, probably the most difficult time in one person's life, but be sure to find support around you. Here is a QR code that provides the 4 Ds to tobacco cessation: distract, delay, deep breathing, and drinking water. And it also provides the 5 Rs to tobacco cessation: relevance, risk, rewards, roadblocks, and repetition. Ask yourself, what is your main goal? Take baby steps. It cannot be done in one day. Ask yourself, is it important to me? What are some things that can help distract you? Is today the day? And remember to give yourself grace. It may take a couple of times to quit, but if you're truly ready, it will happen. Here are my references, and thank you for listening to my presentation on the effects of smokeless tobacco.